Welcome back everybody inside the Anatomy Lab. This is my Anatomy Bench series, and today we are going to look at our first position, the seated position. While we are admiring the top layer of muscle, I want to quickly explain why I even create these videos. These videos are especially dedicated to those people among us who work on clients on a daily basis. For those people who have to have the ability to understand and visualize the human anatomy underneath the skin. It helps us to palpate, it helps us to diagnose, and it helps us to treat our clients a little bit better. Maybe you realize that this video is kind of slow. This has a reason because you should have the chance to stop at any given moment, and you can also zoom in on your device if you want to have a closer look at one of the structures. Of course, there are going to be more parts, and in the other ones I will be showing lying on your back, lying on your belly, and lying sideways. If you have another suggestion, please don't hesitate to leave them in the comments. So I am pretty sure that you are familiar with the superficial layer and you probably can name all the muscles. But remember that we can not only feel and palpate the superficial layer, we can also feel the layer underneath. And here you have it. It's pretty interesting how the view changes once you put away all the relatively big muscles of the superficial layer and just take advantage of the slow pace and wander around with your eyes and see if you can name all the structures. See if you know their origins and their insertions. Maybe you even have treatment plans in your head that you could use for clients and your patients to help them out with their problems. Of course, you can also look out and spot mistakes that I have in the model itself. A hot tip is always the muscle fibers. They are not correct in every muscle yet. I'm working on it and I will improve them in the future. Maybe you even see overlapping muscles. That's a problem with the 3D mesh, or you can even spot other mistakes, and I'm always happy to read your feedback in the comments. I found it very helpful for me to look at the mistakes I make in my model because I really had to clarify with my mental image what is right and what is wrong. So I urge you to activate your inner detective and search for the truth until you are completely sure of every single structure. So let's move on to the last circle of today and let's have a look at the spine muscles and the bones, of course. You also see the quadratus lumborum here on the side, and of course there is the psoas coming up. I very often ask myself when I palpate my clients, how much of those deeper layers do I actually feel and what is just compressed layers that are lying above them. Of course, the best thing is always to find out yourself. So grab a friend, grab a colleague, grab a patient and ask them to assist you, have them contract a certain muscle and try to palpate it. Maybe you can find out what is the muscle itself or what is the structure above it. In the end, remember to stay playful and also remember everything in the body is connected. I hope this has been helpful for you and I hope to see you in the next episode back inside the lab. Have a good one.